Talking of sensational, it's that time on a Saturday morning. We check in with Professor Linda Bauld and Dr. Chris Smith. We're going through the latest developments in the coronavirus pandemic. Chris, Linda, morning to you.
Morning. No spiders on the cameras this end.
No, very clean cameras.
I didn't like that spider discussion at all. I've actually just seen one this morning downstairs. It's that time of year.
Linda, they're more scared of you than you're scared of them.
And also, Chris, I mean, it's
all
not
over my computer.
Yeah,
They're
it's
making
not
a beeline for the World Wide Web, I think.
It's not strictly on topic, but I've always thought there's something quite healthy about spiders being around generally. Is that a falsehood, Chris?
Well, spiders devour all the insects that are trying to devour us. And judging by the number of mosquito bites that I've been subject to in the last week or so, I think it's certainly mosquito time of year. And spiders like eating mosquitoes, as do Venus flytraps, I've discovered, because I've been getting my own back on the mosquito population by feeding them to a Venus flytrap. And it doesn't make the bites any less itchy, but it does make me feel psychologically a little bit better, like I've exacted retribution.
Do you know what? It sounds like you have an irrational hatred of mosquitoes, if I'm being completely honest. But that's something for another
dangerous animal, of course. I mean, they're responsible for more
Seriously,
disease.
what have we
than
got him started on? What have we got him going on?
Yeah, we went down a slightly different pathway there, didn't we? Linda, let's come back. Let's draw us back. I want to talk to you about these new regulations. This, very careful to say, these are in England. The devolved nations as yet have to determine in connection with travel. Can you help us with one thing? A lot of people reading these new restrictions about the testing. So we know that for most countries now outside of the red list, you do not have to do that test before you come back. You are required to do the 2-day test when you are in the UK, but it is different. Can you talk to us about that?
Certainly. I mean, I think what we've seen, Charlie, is many countries are changing their rules around travel for those that have had both doses of a vaccine, and we always expected that. But these changes announced yesterday will be very welcome for the travel sector and many people who I think quite rightly have been concerned about the cost and the complication of the testing regime. So as you say, the shift now that when you come back, you still have to have a test on day 2. At the moment, that is still a PCR test. But what we heard from the Transport Secretary is that might shift to a lateral flow later this month. Now, the controversial thing about that shift from a scientific point of view, and many of my colleagues talking about this, is that we can't sequence a lateral flow. We can't get genetic material from the virus from a lateral flow test, but we can get that from a PCR. And that's what we use to identify if there are variants coming into the country or variants of interest or concern. I think we'll hear that firmed up in terms of whether that's definitely going ahead, just lateral flow. One other option there, Charlie, just briefly, is if you do get a positive lateral flow, remember these tests are less sensitive and specific than PCR, you could then be asked to go for a PCR test so we could get the genetic and genomic sequencing that we need. So that's the change. Great news for travellers, but some valid scientific questions.
Indeed. As always, we love it when you both answer our questions that viewers send in. And, you know, still do have questions. The booster jab, of course, that's been put into administration now. Someone's asking, this is David in Darlington, who says, I'm not due for my booster jab until late November. Will I be able to have my flu jab when I usually get it in September, October, or will I have to wait until the November booster date? I really don't want that flu risk over that extra time. And of course, Chris, for example, we've been talking to Sajid Javid, the Health Secretary, who said, you know, if at all possible to combine them to save time, to be more efficient, that's been one thing put forward.
Yes, and this week a letter was issued from the NHS explaining how this should happen. The JCVI are quoted in that letter as saying, where it is clinically expedient, in other words, where it's useful, helpful for streamlining, for minimal inconvenience, for maximising uptake, the flu vaccine and the coronavirus vaccine may safely be given together. That doesn't mean you mix them in the same syringe. It means you give them at the same visit. But what they also are pains to emphasise is that one should not hold up the other. Getting vaccinated against everything you can, but don't necessarily rely on having them at the same time. You won't be at an advantage or a disadvantage other than a time advantage if you do.
Chris, I'm going to stay with you for this next question from Jules. And this is pertaining to the new plans in relation to young people getting the vaccine. So Jules asks, I would like to know whether children will be given a lower dosage of the vaccine than adults.
The current guidance is that they will receive the first dose And we don't know why we're going for just one dose of the vaccine at the moment. It may be just to leave options open about timing. It could be because we've seen a slight increase in the number of cases of this condition, myocarditis. That said, people shouldn't be surprised if, when they go for their booster, if they receive a Moderna vaccine, they get a half dose, because Moderna have found that they can achieve the same results and the same response with half the dose. And they're saying, actually, this could save potentially 1 billion doses. So their vaccine will go 1 billion people further by reducing the dose of those boosters. So in some cases, yes, we are reducing the dosages, but for children having a dose of the first jab, no. And the reason not to give a smaller dose is that you're targeting the immune system, and children actually have more immune cells and a more flourishing, thriving immune response than adults do. So the dosage actually is appropriate for a child as well as an adult.
Linda, can you just clarify? Obviously, we've been hearing that 12 to 15-year-olds can now have the jab. What's the situation in all the 4 nations?
So that's the case across the UK. We've adopted that advice from the chief medical officers. There was actually a press conference with all 4 chief medical officers, including Dr. Gregor Smith, our CMO here in Scotland. So the programme has been rolled out across all parts of the UK. Right. And I think that's good news. But just one final point to add to Chris, in relation to Jules' question. In the future, some countries are going below age 12, and trials are underway of Pfizer and Moderna with an even lower dose.
Just pick up on the questions about how the 12 to 15-year-olds, how it will work in practice. Because there are lots of interesting kind of ethical questions about parents' permission. In what circumstances, if a child wants the vaccine?
There are, and I think it's important to get the advice from legal experts, and it does vary in relation to different legal systems in the UK. But my understanding is it's very important that children have the ability and the right to decide for themselves, and they are able to do that within our legal system if there's a discordance between what the parent might want and what the child might want, and it's assessment of, is the child able to make that decision? What we really want, Charlie, as we look ahead to this programme, is that informed consent is given from both the parent.
Let's go to the other end of the scale, shall we? Chris, Denise has asked a question. She's over 70 years old, and she says, I've had both jabs, the second one being at the end of March. However, recently I was tested positive for COVID-19. Would it be safe to have a booster? And again, I'm over the age of 70.
Every time we meet, say, a case of coronavirus, what we're doing is reminding our immune system what it's been programmed to fight off. And a booster is no different. Whether you encounter the infection for real or you encounter a booster, both amount to the same thing. They remind your immune system and they help you build a stronger immune response. So yes, the current guidance is, regardless of prior infection status, we should definitely get vaccinated and definitely get boosted. The outcome will be a stronger, more robust and more resilient immune response that will last a bit longer.
The numbers around the people who are not having vaccinations at all. Are we at a point now where there is a hardcore, a kind of known hardcore of people who, for what?
Most people in their 60s, 70s and above, the uptake is really phenomenal. You will have small numbers there who've either not eligible. There are some people for medical reasons who can't have the vaccine or may get it in the future but have not had it yet. And then you're right, Charlie, there probably is a small group who have just decided they're absolutely not taking part in the programme. If you look at younger groups, as you were just saying in the programme a little earlier, it's about 70 to 75% of the 18 to 29-year-olds so far who've come forward, and that varies depending on where you are in the country. So we've still got a task there. I think for that age group, a bit like the discussion on university vaccines in partnership with universities, is not so much necessarily about a hardcore, it's just about making progress through those age groups. As we've discussed on the programme before, and this is a key point, it's an evergreen offer. Expectations around, we talked about travel, etc. So I hope even that group who are uncertain, that their questions can be answered and they will come forward in the future.
Good to see you both, as always. Chris, good luck with that Venus flytrap. Is that it behind you?
No, I'll bring it next time. How about that? It's much bigger. I showed it earlier in the year and I showed it flowering.
Oh,
and,
yes.
And now it has grown enormously. So I'll bring it back and show you. So it's obviously doing very well on a diet of mosquitoes and bluebottles, which is what I've been
when you bring it when you bring it back, can you make sure there's no actual mosquitoes in the Venus flytrap? Because we probably don't want that.
Yeah, it's like a crime scene, isn't it?
I'm not going to rob it of its lunch.
Don't, Linda, don't come between Chris and his Venus flytrap. It's just not worth it, honestly.
I think that's good advice. Yeah.
Take care, both of you. We'll see you soon.
Take care. Bye-bye.